All right, good morning and welcome. Today we're going to be going over the TCCC Technical Combat Casualty Care card. We're going to be filling that out. All right, just to go a little bit of background and purpose and policy. All right, so pre-hospital or pre-medical treatment facility documentation of medical interventions by first responders at the point of injury is critical to ensuring continuity of care and providing meaningful analysis of medical interventions, techniques, tactics, and procedures rendered at the POI. In a deployed combat or training setting, all personnel have the potential to be casualties and all personnel have the potential to be first responders. In accordance with Joint Publication 4-02, Health Services Report dated July 26, 2012, First Responder Care Capability is also known as Tactical Combat Casualty Care. Tactical Combat Casualty Care occurs during a combat mission and is a military counterpart to a pre-hospital trauma life support. Pre-hospital trauma care in the military is most commonly provided by enlisted personnel and includes self-aid and buddy aid and combat lifesavers. Tactical combat casualty care focuses on the most likely threats, injuries, and conditions encountered in combat on a strictly limited range of interventions directed at the most serious of these threats and conditions. DD Form 1380 promotes Department of Defense goals of capturing documentation of pre-MTF medical interventions at the POI using a MIST format, mechanism of injury, injuries, signs and symptoms, and treatments. It is designed for use by all first responders, including non-medical personnel. The policy. Commanders will ensure that all first responders carry and use DD-4 1380 to document pre-MTF care at the POI. Such care relates to both battle and non-battle injuries. Once completed, DD-4 1380 must be visibly attached to the patient. Upon arrival at a Roll 2 or Roll 3 MTF, DD-4 1380 will be included with the paper medical record, then scanned and entered into both the patient's electronic health record and the trauma system's trauma registry. Roll 2 and Roll 3 MTF commanders must establish a clear process to ensure entry of the medical information recorded onto the Form 1380 into both the electronic health record and the trauma registry. DD-4 1380 will be a component of the Individual Improved First Aid Kit, or IFAK, Joint First Aid Kit, JFAK, and the other first aid kits utilized. Corpsmen, combat medics, and tactical evacuation personnel should carry multiple blank versions of the form. First responders will complete all entries as fully as possible on the DD-4 1380 unless under extreme conditions whereby the casualty and their provider safety may be at additional risk. All entries on the form will be made using a non-smearing pen or marker and also should be printed clearly, including the first responder's name. All right, now we're going to go ahead and just move into the form. This is just an example of the form. All right, to begin with the battle roster, we're going to write first letter of casualty's first name, then first letter of casualty's last name, then write the last four numbers of casualty's social security number. So kind of what to look like, for example, John Doe, social 123121234. His battle roster number is going to be JD1234. Now the evacuation or evac, mark an X on the casualty's evacuation priority precedence. That'll be urgent, priority, or routine. Then we just have write the casualty's name, last, first, the last four, write the last four numbers of casualty's social security number. Mark an X on the casualty's gender, male or female. Write date of injury in date, month, and year format. For example, 29-JUN-13. Write 24-hour time of injury and indicate whether local or Zulu time. Write the casualty's branch of service. For U.S. civilians, write USCIV. For non-U.S. personnel, write non-U.S. or a standard abbreviation for casualty's nationality. And then write the casualty's unit name. And allergies, write casualty's known drug allergies. If not drug allergies, write NKDA, no non-drug allergies. And then we move over to mechanism of injury. We're going to next with the mechanism of cause of injury. That'll be artillery, blunt, burn, fall, grenade, gunshot wound, improvised explosive device, landmine, motor vehicle crash / collision, rocket propelled grenade, or other specified mark all that apply. Alright, then we go into the injury. Mark an X at the site of injury on the body picture. For burn injury, circle the burn percentage on the figure. If multiple mechanisms of injury and multiple injuries, draw a line between the mechanism of injury and the anatomical site of the injury. And then for tourniquet application, so it'll be for right arm, right leg, or left leg. If a tourniquet is applied, write the type of tourniquet used and the time of tourniquet application. Alright, and then we go into the signs and symptoms. Record vital signs. There'll be pulse rate and location, blood pressure, respiratory rate, oxygen saturation, and then level of consciousness, so AVPU. A for alert. We have response to verbal stimulus, response to pain stimulus, or unresponsive. And the level of pain on numeric rating scale of 0 to 10, with 0 being no pain and 10 being the worst pain, and that is with time. Okay, now we're just looking at the back of the card. The battle roster is still the same. Write the first letter of casualty's first name and first letter of casualty's last name, and then write the last 4 numbers of casualty's social security number. Same thing with evacuation, mark an X on the casualty's evacuation priority precedence. And then treatments. We have circulation hemorrhage control interventions. So mark an X for all circulation hemorrhage control interventions. For tourniquets, mark category, or mark the categories extremity, junctional, and or truncal, and write the name of the tourniquet used. For dressing, mark the category hemostatic, pressure, and or other, and write type of dressing used. And mark an X for all airway interventions, intact NPA, nasopharyngeal airway, CRIC, cricothyroidotomy, ET tube, endotracheal tube, SGA, supraglottic airway, and write the type of device used. Okay, and also mark an X for all breathing interventions. That'll be O2 oxygen, needle D, needle decompression, chest tube, chest seal, and write the type of device used. And then we have the circulation resuscitation intervention for fluid and blood product. So for fluid, write the name, volume, route, and time of fluids given. Blood product, write the name, volume, route, and time of any blood products given. Same thing with medication, meds, analgesic. You can write the name, dose, route, and time of any analgesics given. Same thing with antibiotics. And under medication other, let's see here. Okay, the medication others, you're going to write down just the same thing. So write name, dose, route, and time of any other administered medications. And then under the section for other, mark an X for other treatments administered. Combat bill pack, eye shield, mark right or left. And then splint, hypothermia prevention, and the type of device used. And then we go to the notes. Use a space to record any other permanent information or clarifications. And the first responder's name, print the first responder's name last and first, and write the last four numbers of the first responder's social security number. And that is just a brief overview of filling the TCCC card. Thank you.